How to follow patients with IPF. Generally, we'll see them every 3 to 6 months. We'll obtain PFTs, even if it's just spirometry at every visit. We'll look at their 6-minute walk distance and monitor both their distance as well as their SpO2 NIDA to see if they need supplemental oxygen or not. We're always aware of comorbidities that might complicate the course of IPF and always on the lookout for that because these might impact both their quality of life as well as their potential outcomes. So things like coronary artery disease, thromboembolic disease, GERD, obstructive sleep apnea, these are all things or entities that can complicate or be associated with the course of patients who have IPF. A question often comes up as to when to get or repeat the CT. Now, the HRCT is essential to make a diagnosis of IPF, but it's a little bit of a blunt instrument in terms of following the clinical course. And typically, we rely more on physiology, specifically PFTs and the 6-minute walk test to follow the course of patients with IPF. I usually will repeat a CT annually, not necessarily or so much as to follow progression of disease, but to screen for things like lung cancer. Lung cancer is one of the comorbidities that can complicate the course of patients with IPF, and it's estimated that perhaps about 10% of patients with IPF will die as a result of developing lung cancer.